In this presentation, we will be discussing both the negative and positive effects of vaping. To discuss, we must first understand the stimulant nicotine before discussing the risks and benefits of using it in a vape. Firstly, vaping can assist adults in quitting smoking cigarettes. Cigarettes contain over 6,000 chemicals, 69 of which are carcinogenic. Although not without risks, vaping is considered less harmful than traditional cigarettes because it eliminates combustion and the production of harmful tobacco chemicals, instead generating an aerosol or vapor. As a smoking cessation aid, vaping, along with other options like Wellbutrin patches and pouches, significantly improves the success rate of quitting smoking. Excessive consumption of stimulants such as nicotine can result in various side effects, including mood changes, shortness of breath, chest pain, anxiety, and nausea. Additionally, there are specific risks associated with vaping, such as EVALI, lung injury, and popcorn lungs caused by inhaling diacetyl, leading to an inflammation and scar tissue buildup. Nicotine also hinders bone cell growth, which is crucial as 90% of bone density is acquired by the age of 18. The FDA began regulating vaping products in 2016, classifying them as tobacco products and banning certain flavors for use in pods. Vaping can serve as a gateway to other substances like weed, cigarettes, and alcohol. Electronic cigarettes were introduced in the Chinese market in 2004 by inventor Han Link as a smoking cessation aid. Nicotine absorption from tobacco occurs rapidly within 10 to 20 seconds, whereas nicotine replacement therapy devices like patches and pouches do not receive the same peak blood nicotine level as tobacco. E-cigarettes, on the other hand, deliver nicotine more slowly, with peak levels reached in approximately 20 minutes. Research comparing the blood and plasma levels of non-smokers to regular smokers showed that non-smokers did not experience the same increase, indicating the potential for e-cigarette companies to use this study as evidence for their products' efficacy in replacing cigarettes. Furthermore, women generally have lower plasma nicotine concentrations compared to men and experience faster recurrence of cravings. Following the outbreak of EVALI, there was a significant increase of 130% in vape-related news articles. However, subsequent research revealed that majority of problems were associated with products containing THC rather than nicotine. These news articles had the power to influence people's perception of the risks associated with vaping. Vitamin E acetate was identified as a direct link to EVALI cases. Consequently, when vaping-related news events occurred, such as EVALI outbreak, the ban on certain flavors by the Trump administration, and the investigation of vape-related injuries by the CDC, consumers purchased fewer vaping products. This information could assist government bodies and the FDA in understanding how to address and intervene with vape sales following such news events. This study investigated the relationship between psychological distress and tendency to use e-cigarettes as various forms of substance. The results revealed associations between psychological distress and cigarette smoking, e-cigarette use, cannabis, vaping, and intentions to use e-cigarettes. Female participants showed higher rates of current e-cigarette use and cannabis vaping, possibly due to higher levels of psychological distress. Interactions between intentions to use e-cigarettes and psychological distress were found for all smoking and vaping behaviors. This study suggests that the public health effort should focus on providing psychological services to young adults as an alternative to smoking and vaping behaviors. Overall, nicotine and e-cigs could be a powerful tool to help smokers quit their nasty habit. However, it becomes a problem when placed in the hands of young non-smoker adults who use it and abuse it and become addicted.